How can I talk about bipolar with my primary care doctor? Talking with your primary care doctor about bipolar disorder is an important step toward understanding your mental health and getting the right support. Bipolar disorder is a long-term condition that involves episodes of mania or hypomania, where you might feel unusually energetic, impulsive, or restless, and episodes of depression, where feelings of sadness, hopelessness, or loss of interest take over. These mood swings can impact your daily life, relationships, and work, so clear communication with your doctor is key. Before your appointment, it helps to prepare. Write down your symptoms, noting when they started, how often they happen, and how intense they are. Keep track of changes in your mood, energy levels, sleep patterns, or behaviors. For example, if you notice periods of feeling extremely energetic or irritable followed by times of deep sadness or fatigue, jot these down. A daily mood journal can reveal patterns that are useful for your doctor to see. Be honest about your mental health history, including any past episodes of depression or mania. Mention if anyone in your family has a history of mood disorders, as this information can help your doctor understand your risk factors. Also, list any medications you are taking, including over-the-counter drugs, supplements, or herbal remedies, since these can influence your symptoms or treatment options. When you meet with your doctor, start by sharing your concerns about bipolar disorder and explain why you're worried. Use the notes you prepared to describe your symptoms in detail. Talk about how these episodes affect your daily activities, relationships, and work life. Don't hesitate to mention both the high-energy phases and the low, depressive phases, as understanding the full picture is important. Your doctor will ask questions to better understand your experiences. They might use screening questionnaires designed to identify symptoms of depression or mania. These tools are not diagnostic on their own but help guide further assessment. If your doctor suspects bipolar disorder, they may refer you to a mental health specialist such as a psychiatrist or psychologist for a more detailed evaluation. This is a common step, as mental health professionals have specialized training to diagnose and treat bipolar disorder accurately. Diagnosing bipolar disorder involves a comprehensive clinical interview and sometimes additional assessments to rule out other medical or psychiatric conditions. There is no single test for bipolar disorder, so diagnosis depends on your reported symptoms, medical history, and sometimes input from family members or close friends who observe your mood changes. Treatment usually combines medication and therapy. Medications might include mood stabilizers, such as lithium or certain anticonvulsants, and sometimes antipsychotics. Therapy options like cognitive behavioral therapy or psychoeducation can help you understand your condition, develop coping skills, and reduce the risk of episodes recurring. Your primary care doctor can coordinate your care, monitor your progress, and refer you to specialists if needed. Regular follow-up appointments are important to adjust medications, manage side effects, and address new or ongoing symptoms. Effective communication is vital. Be open and honest about what you're experiencing, and don't hesitate to ask questions if something isn't clear. If you're unsure about your diagnosis or treatment options, write down your questions beforehand so you remember to ask during your appointment. Remember, finding the right treatment can take time, and it's okay to discuss any difficulties or side effects you experience. Your doctor is there to support you and work with you to find the best approach for your individual needs. If you experience severe symptoms, such as thoughts of harming yourself or others, or if you feel unable to keep yourself safe, seek help immediately. Contact your doctor, go to the nearest emergency room, or call a crisis hotline. Your safety is the top priority. In summary, preparing for your appointment by tracking your symptoms, being honest and detailed, asking questions, and following up regularly can make a big difference. Involving mental health specialists when recommended ensures you get comprehensive care. Talking openly with your primary care doctor about bipolar disorder is a positive step toward better mental health. Your doctor can help you navigate the diagnostic process, connect you with resources, and support you throughout your treatment journey.